we're making tremendous progress in terms of lab testing. Tens of thousands of tests are being done every single day, both through the CDC and the public health labs, as well as now through the private sector commercial labs. They're getting to scale. They have supplies. They have high throughput. We do hear anecdotally occasionally of, say, a public health lab or another one that has a concern about this supply or that supply. Through FEMA, we actually are standing up a laboratory task force to answer those questions. Usually it's that the lab people do not understand that there are actually alternative supplies in the marketplace that they are perfectly free to use. We've actually had to put out some common myths and truths about that. For instance, the other day, we were getting calls from governors saying, we don't have swabs, there are no swabs, there are no swabs. Our supply people went in the open marketplace and bought 200,000 swabs in the open market, and I just sent a letter to every governor sending them swabs. So some of it's just they aren't listening or checking with us about all the freedom, all the capacities out there. It's a complex system with 330 million Americans and all of these labs. So sometimes there's a lab that doesn't understand how much flexibility they have and how much supply there is out there. And we're working through the new FEMA Integration Center to help correct that for folks.
Secretary Azar.
Be happy to. How well that's working. Well, as I said, more and more tests are being performed every day. And as we learn about the results that are being reported around the country of coronavirus tests, our experts continue to look at the numbers and see that some 90% of Americans that are tested do not test positive for the coronavirus. And so it can give you a sense of the magnitude of testing that's going on. We have the number of cases that we've reported today, but it's in some cases near to 10 times that have been tested. But let me also emphasize how important it was in answering these questions for governors and local officials that the President stood up FEMA and the National Response Center, where we briefed governors yesterday. Now every governor and their state health departments have the ability to reach out to our regional FEMA administrators. And that's how, as the President said, we're sorting out those potential conflicts between very significant federal purchases and procurements and as hospitals and state governments are purchasing as well. I think the new streamlined system operating now in all 50 states and our territories of governors and states going through their regional administrator for FEMA is going to make it more possible for us to ensure that our hospitals, our healthcare providers have access to what's available on the open market and elsewhere.
Mr. Vice President, you're the head of the task force. You've seen the numbers. You've spoken to average Americans. You're a former governor. What do you say to Americans right now who are watching and who are scared?
I would say do not be afraid, be vigilant. All the experts tell us that the risk of serious illness to the average American for the coronavirus is low. But we need every American to put into practice the President's coronavirus guidelines, 15 days to slow the spread, because the coronavirus is about 3 times more contagious than the flu, according to our best estimate. And you can contract the coronavirus, have very mild symptoms, if any, not even be aware that you have it, and expose someone who is vulnerable to a very serious health outcome. That's the reason why we're encouraging people to avoid groups of more than 10, to not eat in restaurants, but to use drive-thrus, to wash their hands on a regular basis. And particularly, we're going to continue, as the President has directed us, to focus on the most vulnerable population, which are seniors with serious underlying health conditions or anyone with an underlying immunodeficiency. It's those people we need to care for, but it's going to take all of us working together to make sure they're safe.